it's really difficult to know. There's a lot of debate amongst experts right now as to whether or not B117 is impacting this increase in COVID in children. What I'd like to point out for sure, though, what we do know for certain is it's not Iowa, right? This is a global phenomenon. You can look at all of the societies, Israel, the UK, Europe, all sorts of places. It seems to be somewhat associated in timing with when you get to sort of partway through vaccination. Seems to be when that pickup in the kids' COVID starts, but it's not a tight, it's not a hard and fast rule. And it might be associated with B117. Now, that sounds kind of scary, but it might, and there's sort of a natural leap to this, oh my gosh, B117 affects kids and it didn't, whereas the other ones didn't, which is not necessarily the case, right? B117 is more contagious. So anybody who's not protected because they just had it, or because they're vaccinated, or because they're on their own at home and not actually contacting anybody, right? So those are the protected people. But if you're not one of those protected people and there's a more contagious variant going around, you're more likely to get infected. So it doesn't mean that B117 has it out for the kids of our world, but it probably is part of this because it is more contagious. It's also probably, though, associated with vaccine. And again, we don't have it all worked out yet, but there may very well be some things that we may be changing our behavior when we're immunized, but we can't immunize our kids yet. And so that might also be part of why our kids are getting more transmission happening.